Hello everybody, I'm Dr. Aparna, Clinical Director Neonatology at KIMS Cuddles, Kondapur, Hyderabad.
I'm Dr. Jayanth Krishna. I'm a Pediatric Neurologist and a Clinical Geneticist at KIMS Cuddles.
So Dr. Jayanth, today is Autism Awareness Day.
Yeah.
Every April 2nd is observed as Autism Awareness Day. So can you throw some light on what is autism and why do they call it Autism Spectrum Disorder?
Yeah, we prefer the term Autism Spectrum Disorder. It's like because there's a whole range of severity. It can range from mild, moderate and severe. So we don't specifically use the term autism. That has been discouraged because not everybody is that severe. So it's a spectrum. Some can be mild, they are very special as well. They have special skills as well. So I think it's a well-recognized day on April 2nd that we do this for the awareness of autism. And what parents need to know as in India, the incidence has risen in the last couple of years, especially after the pandemic. So that was a major agenda that we'll try to discuss what exactly happened in the last few years, what can be the parents be aware of, what are the potential complications and treatment aspects today.
Right, so you spoke about the incidence increasing.
Yeah.
So can you please tell us what is the incidence now?
Yeah.
And also whether this is genuinely increase in incidence or is it because we are detecting autism earlier now?
True. So the incidence has definitely risen in the last couple of years and from the post-pandemic era. So the CDC has given us few statistics saying that the current incidence is around 1 in 31. So that is pretty alarming.
Yeah.
And that too, I feel that it's the tip of the iceberg because most of the cases go undiagnosed sometimes and under-recognized. You know, most often parents don't even come with a complaint to the doctor, so they go undiagnosed for a lot of years. And sometimes doctors may also miss it when they don't see a specialist. So in my personal opinion, the incidence is way more than 1 in 31. But, and also in the last couple of years, the incidence and the picking up also has increased because now we have more and more awareness in cities and most of the parents are also aware thanks to the social media. So now the increase in the incidence is also because of increased picking up.
Right. So 1 in 31 is actually a huge incidence. Speaking of how common that is, it almost means 3% of children are having some symptoms of autism spectrum disorder. So talking about the symptoms, now we are all aware that early detection is very important. So as parents, as caregivers, can you tell some common early markers of autism, like in a small infant less than 1 year or in a toddler less than 3 years? What are all those subtle clues that should make parents, that should make the other caregivers suspect that they should seek help of a pediatric neurologist or developmental pediatrician to rule out autism?
Yeah. So there are subtle features that you can know in less than 1 year, that is between 6 months to 12 months. And we have definitive features which are more alarming in between 12 to 24 months. So as I say, the core features of autism is basically language and social communication. So if I give you an example, the most commonest one is decreased response to name calling. So which should ideally happen between 8 months to 12 months. They don't respond to name calling. And the early eye contact between the mother and the child, even that is also alarmed. Sometimes they don't make any eye contact and very minimal facial expressions that can be picked up. And after 12 months to 24 months, so there is an obvious sign, it's called language regression. My child used to say these words. I mean, my child started saying monosyllables, ma, pa, papa, and after 12 months, suddenly he stopped saying that completely. So that's called language regression. That's a very alarming sign of early picking up. And along with that, there's another feature which is called repetitive movements or stereotypies, what we call excessive flapping, hand flapping, clapping, head banging. These could be some of the features of autism which should alarm parents to seek immediate attention.
Right, so not responding to name, not engaging in meaningful social communication, language delay or regression, and limited social interaction, stereotypical behavior. These are all some early signs. Now, talking about this language delay, a lot of parents generally when we see them in our regular practice, they tend to say this, in our family, everyone started talking late. The child's father started talking when he was 4 years, mother started talking when she was 3, and they're all doing well now. So it's okay for us to wait till 18 months, 24 months for the child to start speaking. Do you agree with this?
No, absolutely not. I think the biggest problem in India is because grandparents are never exposed to this entity because it was very rare back then. And isolated language delay can sometimes be familiar, parents having delayed language can sometimes come to the children because of the genetics, but it's never advised to have this wait and watch policy, because at the max what will happen, you'll see a specialist, you'll get it assessed. We don't have any invasive testing, we don't do MRI, all that we do is we'll have a questionnaire, a 1 hour talk with a specialist. So I think it's better to get it done rather than wait and watch. And most of the times it's like autism starts with language slowing or regression. Sometimes it can be misinterpreted as only isolated familial delay.
Right.
So never wait. I mean, why is it so important is because the earlier you diagnose, the better the response with the therapy. You keep waiting, that's the commonest mistake a lot of people do in India, that the denial concept, the parents don't accept the fact that, how can this specialist call my child autistic? So there's a phase of denial that's understandable as parents and mothers. But the whole point here is because of that fact, the denial actually they'll take more time for everything. Right. So by the time they come, it will be usually 3 or 5 years, and it's already too late.
Right. Yeah. So I think that highlights a very important point that autistic spectrum disorder is not like a mental disease. It's not a it's not like a non-treatable disability. It is a condition where children are different in terms of their social adaptation, and they would improve significantly with early support. And that's what Dr. Jayanth is highlighting, that subtle clues in infants or a language delay should not be passed off as normal, because you may be at the right window of time where intervention can help. So now let's say a family seeks your support for a 18 to 24 month old child who is having language regression or no significant language. And you suspect autism. Yeah. So how does the process of diagnosis go around? Now, what kind of tests do we employ, and how do we actually diagnose ASD?
So the biggest challenge in diagnosing autism is that we don't have a single test which says that, like for example, a child has thyroid problem, I do a simple blood test and it comes positive or negative. True. But unfortunately, we don't have that in autism, because no objective test which is tell you diagnosis that autism is there. So we need to go see a specialist, ideally a pediatric neurologist or a developmental pediatrician. So we have various scoring systems, so which are standardized. So we ask you a lot of questions, so it's like a checklist, and finally you have a score which is coming out of the 1 hour process, what happens. So apart from that, we also see this scoring in different settings. For example, if your child is having a bad day, there could be a high score that day. Yeah. So we patiently look at 2 different situations, and finally we give you a scoring at the end of 2 or 3 visits about is it falling into autism? If it's falling into autism, is it borderline, mild, moderate or severe? So based on that, we'll get a rough idea of what we are at diagnosis of autism spectrum, or some other diseases which are very closely linked to autism spectrum disorder. Like for example, it's called SPD, sensory processing disorder. It doesn't fall into the umbrella of ASD, but it is somewhere related. But do not go by the theory that my child is labeled as autism. Right. Don't worry about that, because it's all because a lot of school and a lot of the social taboo about autism these days. Yes. But this diagnosis is only important for your treatment of your child. That is more important.
Absolutely true. We see sometimes mothers, fathers petrified and stressed with what that would mean in terms of a diagnosis. This is not about labeling, or it's not about diagnosing some major disability. It's all about making an early detection of certain differences in the way the child is developing, so that we can intervene early. Now, talking about diagnosis, you did mention that this is mostly in the form of checklists. These days we keep hearing of this new test called FRAT testing. So can you throw some light on FRAT testing, how useful it is?
Yeah. So when we talk, I think a lot of questions come from parents like, why did this happen to my child? So a little bit about how autism happens. It's a multifactorial disease. For example, for instance, I take 10 children and I give them 12 hours of screen time. Not every one of those 10 children will develop autism. Only 2 or 3 children with a genetic background and other risk factors together will get autism. So that example is for multifactorial events. There are 2 or 3 things together causing autism spectrum. So there are a few genetic causes. For example, few genes which cause specific autism in that child. So one classical example was cerebral folate deficiency. So there's one gene which causes absorption of folate into the brain. If that gene is defective, you have folate deficiency inside the brain, that causes autism. So from that concept, recently in the last couple of years, a lot of researchers have come with a new concept they're saying that from the birth they don't have this deficiency, but they somehow develop antibodies to the folate receptors, which are at the junction of brain and the blood near the choroid plexus. So they are proposing that there are antibodies which actually block these receptors so that the folate is not effectively going inside the brain, causing a secondary folate deficiency, and that causes autism. So there are a few tests available now which are called FRAT testing, that is folate receptor antibody testing, which are high. That means there is antibodies which are blocking. So that means there's a potential chance that your child may benefit from folinic acid.
Right. So what you're trying to say is there's a combination of genetic predisposition and environmental factors that eventually results in autism. So if supposing someone just turns out positive for FRAT testing, it's not necessary that the child has full-blown ASD, but they are at risk of developing ASD.
Yeah.
So talking about environmental factors, one of the important factors that we all discuss is understimulation, not taking enough time to talk with our children, which is a problem that we all have as today's generation's parents, and the role of screen time. So can you enlighten something about the role of screen time in the causation of autism?
Yeah, so there are a lot of studies which actually say both ways, like excessive screen time causes autism spectrum disorder, and also the vice versa, like autistic patients are more inclined to have high screen time. But if you see the ultimate the concept here, as ma'am said, it's actually the decreased interaction which is more causative in autism spectrum disorder. And also there are a lot of studies which say higher the screen time, higher incidence of autism spectrum as well. Because technically increasing screen time basically means that there is less human-to-human interaction, which is the commonest thing in India. I mean, a lot of Indian parents say that we only give screen during feeding. But if you logically see, there's feeding almost happening like 4 or 5 times a day. That takes it half an hour into 5, it's more than 2.5 hours. It's very, very high for a child who is growing, especially between 12 to 24 months. So I think screen time should be like completely cut off. I mean, there's no zero screen time in less than 2-year children.
Yes. So IAP recommends zero screen time less than 2 years, and even beyond 2 years, they say not more than an hour in a day. And if you see most Indian households, it might be running into many hours a day. Some ways to cut down screen time include offering alternatives like just music, probably when you want the child to be engaged, or you can have stories played in the audio format. And of course, they're trying to engage the child with other means and ways, trying to have peer interaction with children of similar age group. So putting them in a play group or play school, that way actually helps in engaging children by interacting with other kids. All these as a replacement for screen time. I know it's easier said than done, but that's a very important step towards reducing the incidence of autism. Now, we have discussed so much about risk factors and about the signs and the symptoms and detection of ASD. Now, can ASD be cured? And if not completely cured, what are all the behavioral therapies that make children function more effectively when they grow? And can children actually outgrow ASD?
So we don't use the term cure in autism spectrum disorder. Cure is like completely taking out the disease from the roots. Like for example, somebody has malaria, I give an antibiotic of 1 week and the malaria is gone from the body. So we don't use the term cure, we use the term treatment for autism spectrum disorder. So primarily 90% of treatment is non-medical or non-pharmacological. We don't give any drugs or medicines for it. So the major treatment would be occupational therapy. So this occupational therapy includes various therapies which actually stimulate the child wherever the child is deficit. So we need to have frequent sessions which include speech therapy, occupational therapy, and you do observe improvement in a few weeks to months as the child develops, and there's a significant improvement with if you have a very good and compliant therapy. I mean, I wouldn't say that the child becomes completely normal, but if you see the severe cases will become moderate will become mild, and mild will become borderline. So the ultimate aim is to give as much as possible so that he'll be independent.
Right. So a lot of children can actually start functioning normally to the point that they can integrate into school and they can, they can cope up with their academics and social milestones. So can they, as they grow into adults, can they kind of get into meaningful jobs and kind of communicate normally? Is that possible?
Yeah. So it depends on the severity of autism, but most of them actually, if they get a proper therapy on right time, and most of them can actually have their own independent lives. So that is important, that catching up autism spectrum on time is very important. They can have normal lives as well with few deficits. I think that can be handled too.
Right. So that's very reassuring. So I think this day, April 2nd, on Autism Awareness Day, I think what we all should pledge to ourselves is, we don't ignore early warning signs of ASD in young infants and toddlers. And we definitely do not have to feel stigmatic about this diagnosis, because this is extremely common. And having a child with this different ability, it's not a disability, it's a different ability, is actually not a cause for parents to feel stressed and anxious. Please seek out help at the right time. We have pediatric neurologists, we have developmental pediatricians, we have excellent child development centers where therapy, early intervention and behavioral interventions can make difference and help children with ASD function near normally as they grow and as they evolve into adults. Thank you so much, Dr. Jayanth.
Thank you.
Do you have a parting message too?
No, I think in India, a lot of parents struggle with the denial concept. So I know it's very difficult for parents to accept that they have autism, but I think if you get past that, everything will be a little easy for you. I mean, once you start seeing improvement with therapies, so never back down in seeking help, rather than never wait and watch. That concept never works in autism spectrum.
Absolutely. So even if there is a little doubt and even if there is a suspicion, I would also say there's no doubt, there's no harm in seeking out help and taking the help of therapy, because it doesn't do any harm to the child. So with that message, thank you all for joining us on this podcast, and we'll hope to see you with more such podcasts. Thank you.